Good morning. We're coming to you from San Diego, California. We have a patient with genitopelvic dysesthesias. She's undergone a very comprehensive workup with one of the most famous sexual medicine doctors in the planet, Dr. Irwin Goldstein, and he has identified the problem as a neurological problem. Through neurogenital testing, he's isolated to what we call region 3, which is the lumbosacral spine. And then we did a targeted injection at L3-4 on the left side to treat this annular tear. And she got marked temporary improvement of her symptoms. But unfortunately, all those symptoms came back. So we will proceed with surgical treatment now that we've identified the main contributor or a significant contributor to her symptoms. And we'll utilize a minimally invasive laser endoscopic technique to do a discectomy and annuloplasty. I'll be looking for entrapped pieces of nucleus fragments within the posterior annulus and to try to identify ongoing inflammation that is perpetuating her symptoms and treating that as well. We're all hoping for a great result so she can get back to her lifestyle. We are all hoping for the best. Shot. I want to get the facet joint really well shot. Hope she doesn't wake up with a funny feeling leg for a few hours. Okay, I will take the 10 blade. All right, I've got the skinny little noodle dilator in, shot. Now I just stuck this tiny little needle inside the disc and I'm going to inject this blue dye and watch it leak out the back. And then I can be like a little kindergartner. I'm going to color and do surgery by color. Shot. Shot and save. There it is, shot and save. Shot and save. The disc is definitely degenerated. Should look like a hamburger. 2 buns and a patty, shot. And then see how it's leaking out the back there? There's a line that's going pretty far up. And we'll be like kindergartners, like, there's the blue, teacher. You can imagine what this was like with the patient awake. They'd be like, what is that, shot? They'd be asking me, anything, Deborah? Right there. Pusher. All right, so there's the disc. It's not blue out laterally because your annular tear is in the middle. But I can already tell, look at that. That disc is supposed to be firm and rubbery because it's supposed to be a shock-absorbing hockey puck. It's more like a sponge, like a dish sponge with dirty dishwater. Just want to squeeze it all out. There's the canal, that little arch right here. I don't know if you can see it. There's a name for it. We call it the Wagner arch. For the guy that goes on and on about it, who's one of the guys that showed me how to do this surgery. He's from Germany. He's a retired professional speed skater. So his thigh is the size of my waist. And his hands are like twice as big as mine. He holds this without this mount. He holds it like this, like this, like this, like this. The blue dye, remember it's in the middle? Look at that, it's gonna pop out like a pimple. It's kind of eerily gratifying. You know, it's gross, but you're stoked at the same time. Okay, I'll now take the laser. All right, so I got the laser in, my favorite instrument because it is like a magic wand. It is precise, it makes things disappear. Most instruments that ablate or vaporize tissue creates a ton of debris and you can't see anything because of the cloud. This is like that movie Envy where they spray that thing on the dog poop and it disappears. And they're like, where does it go? Because that's what I'm thinking. I'm like, where does this go?
Laser training, gas up, and hand for an sphincter and then right tibia out anterior.
So here is the benefit of the laser. Stop for a second. All right, so here's the laser. It is unbelievably precise and it's non-conducting. You know how electricity will conduct? This is all mechanical. Look at that. It's like, it's just magical. It's disappearing. And when I was using the electrical instrument, I was getting some jumping because of the conduction of electricity through conductive material like tissue and water. And this is non-conducting, precise, and fun. Look at my little pinky sticking out. It's very refined. It's like having tea versus downing a pint of beer all at once. This is more sipping. Okay, so, I'm going after the blue.
And we're all set for Wednesday, by the way.
I had it.
Oh yes, it is an empty cavity. Thank you, Steve.
All right. Thank you.
Yep, this is not a hard disc. This is definitely an entrapped nucleus. I'm so excited. Look at that. It's just like taking a breath of fresh air. It's like, why did you keep me trapped in here this long? Look at that.
Wow. Her husband just called back or returned the call. He let us know everything's going fine.
Oh, there's so much caca-poo-poo in here. Look at that. I'm so excited. Look at that. Yes. Wow. I'm feeling really good about this now. Look at that. It's weird. It's so much tactile feel. I can kind of feel something's not right in there now. I know. That doesn't make any sense, Dr. Kidd. Okay, it's starting to feel better. I feel a little bit right there. Oh, yes. There's a lot more disc fragments than I thought was going to be in here, but that makes sense. Oh, it went beautifully. I saw a lot more badness than I thought I was going to see, so I'm really optimistic that you're going to get a whole lot better. I was able to do it through this tiny little incision. Hopefully you won't even be able to find it, although you do have perfect skin. So we're all wishing you the best of luck on a really awesome recovery. I just love that. Look at that. That's the world's most expensive Band-Aid right there. We're at the Mission Valley Heights Surgery Center with the most awesome team in the whole wide world. And look at that, we're totally matching. We're all like, hey guys, should we wear blue today? And we're like, yeah, let's all wear matching blue.